Alright, today we're going to go over med passes. These are going to be your oral medications, intranasal ear drops, eye drops, topical, and we'll do orally inhaled as well, and nasal medications if I didn't mention that. First thing that we're going to start here is we're going to confirm medication orders, and time medications are due compared to the MAR ×3. We want to do this as we're removing them from the supply drawer, making sure that we're checking the orders, and then we're going to do this as we prepare the medications, whether in a cup, a syringe, and then we're going to do that for the last check as we give the medication. Another critical part here is we want to calculate the appropriate dose of medications. You have your orders and different kinds of medications. We want to make sure that we're giving the appropriate dose. We're going to perform our skill overriders, K-wipes, introducing ourselves, checking the bracelet, to identify our stand check it, 6842, hand hygiene, provide privacy, and all that stuff. We want to make sure that we're going to complete a pre-admission medication administration assessment. We want to make sure we're checking our allergies, our labs, a set of vital signs, a physical assessment, and then for this one we want to make sure that Stan can swallow because we will be giving some oral medications. As we're giving the medications, you want to make sure that we're following the 6 rights of medication administration. We want to make sure we have the right medication, the right dose, the right patient, the right route, the right time, and the right documentation. We want to educate our patient on what the medication is being used for. Why are we giving this medication? Why are we giving our prednisone or whatever we may be giving? What kind of side effects might this drug have? And that's it. We will have our drug books available next week that you can look through. Just get comfortable looking up those drugs. And then at the end, we want to make sure that we're documenting appropriately. Our first one we'll do is our oral drugs. We have an order here that we're going to give. We're going to do 2 different types of oral. We're going to do the oral solution. We're going to give prednisone. You will have medicine cups and syringes. I always prefer a syringe. It's easier to accurately do a dose. We have an order for 20 milligrams of prednisone twice a day, and if you look at your orders, it actually says for the inflammation. I want to get my prednisone. I'm going to open it up, and I will pull out 5 mLs, and we want to verify that dose with the instructor. And we can give this, we can squirt it into the medicine cup, you can squirt it directly into the patient's mouth, however you prefer to do that. The next thing that we want to do for our oral medications is tablets. I have an order here for 500 milligrams of glucophage by mouth 3 times a day for diabetes. And again, we're wanting to check that the 3 times as we get out of the drawer as we prepare it. I have 500 milligram tablets of glucophage. The order says 500 milligrams 3 times a day. I'm only going to be given 1 of these. I want to put this in a cup, and at this point you can ask Stan, do you prefer to have this with water, or do you want to put it in applesauce and swallow it? That is it for, and you can crush it. This kit doesn't have a crushing thing, but you can crush certain medications. You do want to discuss when you can't crush medications. Those would be anything for like extended release or enteric coated, special times that the medication needs to be released into the body. When we go to our topical, our patch, I have my Nitroderm patch. I'm checking the expiration dates as I do these. I have Nitroderm patch, transdermal 0.3 milligrams per hour every morning for chest pain. I have the same thing here, 0.3 milligrams per hour. I will want to, if I have an old patch on, I want to be sure that I remove that, and I want to clean the skin. I want to rotate my patch to a new spot. I'm going to clean the skin, and I'm going to apply the patch. And I want to date and time the patches. Also make sure that you're wearing gloves whenever you put on nitrogen patches, because it is a topical medication and it will get onto your skin, and it will actually, on a nitro patch, it will drop your blood pressure. Ophthalmic, you want to have the patients laying down. You never want to touch the artificial tears here. We have artificial tears, 1 to 2 drops both eyes as needed for dry eyes. This is not a scheduled dose, but we can say, Stan, would you like some eye drops? Well, Stan does want some eye drops. We want to avoid the cornea. We never want to touch the eye with the dropper. You want to place pressure to the lacrimal duct after giving medications and going from the inner to outer canthus. Stan's eyes are shut here. You'll put 2 drops, put some pressure here, and then you would do that to both eyes. For our eardrops, we want to make sure that we're doing those at our Debrox eardrops. Debrox 2 drops both ears twice a day for earwax buildup. We want to make sure that we administer these at room temperature. It can cause some dizziness if they are administered at other temperatures. You want to make sure that we're not going to occlude the ear canal. We're going to have Stan lay on the side that we're going to administer on. We're going to pull, if it's an adult, kids greater than 3, we're going to pull up and back. If it's younger than 3, we're going to pull down and back. We want to place 2 drops in the ear. We want to push on the tragus and have Stan lay on his side for a few minutes, and then we want to flip them back over, make sure that we do both ears, because the order is for both ears. Now we want to do our nasal spray. We want to give Stan, we want to check for any irritation under the nose. We want to give Stan a tissue to let him blow his nose. We will have our nasal spray. It is calcitonin, 2,000 units, 1 spray each nair every morning for hypocalcemia. We will block 1, squeeze, tell Stan to inhale, and then we will do the other side. And you want to make sure that Stan doesn't blow his nose for the next several minutes. Lastly, we will do our albuterol inhaler, 2 puffs 4 times a day and as needed for shortness of breath. We will go ahead and give that. It wants you to talk about when to use a spacer. This is your spacer. You'll pull the cap off here, you put it in here, and then the mouth will go here. The spacer is typically used for young kids and sometimes older adults, that it's a little bit difficult for them to get that breathe, but realistically anybody can use these because it makes the inhaler just a little bit easier. We want to make sure when we're going to shake this well, we want to have the patient exhale and then spray, inhaling for 3 to 5 seconds, and then try to hold the breath for 10 seconds and then breathe through their nose. Exhale through their nose. We do want to make sure that after we give the inhalers, especially when we start dealing with like corticosteroids, we want to make sure that Stan rinses the mouth out so to avoid any fungal buildup. And at that, we'll discard our stuff, wash our hands, and document everything we've done. And that is it for your med passes.